Hey everybody, it's Dr. Eric Balcavage, and we're back for another edition of Thyroid Thursday today. And today I'm kind of continuing this discussion of this week's theme, which is your thyroid physiology oftentimes is not broken. You're not broken. Your immune system is typically not out of control, but your immune system and your thyroid physiology is adapting to the stress on your physiology. And that is a paradigm shift for most people. So let's talk about it. So the current thinking, especially in the traditional medical model, is that you have an immune condition, you have an autoimmune condition, you have a disease or disorder where your immune system has stopped identifying your thyroid tissue as self-tissue and it's destroying it. And in that model, they believe there's nothing you can really do to recover your thyroid physiology. So the goal is just to replace the T4 that your thyroid gland can't make until your TSH is back into a range. And there's nothing you're going to be able to do. And so you're going to be a slave to thyroid medication for the rest of your life. And for some people that works and they feel good. But there's a lot of you out there that continue to struggle with hypothyroid symptoms and sometimes hyperthyroid symptoms as your doctor kind of titers up and down your thyroid medication in an effort to manage or manipulate a TSH into the range that they think is most appropriate. The problem is, it assumes you're diseased, it assumes you're dysfunctional, it assumes your immune system's out of control, and that the only solution is to take thyroid medication for the rest of your life. So that's that model. And again, nothing is done to address the root issue, the root cause. So how would you ever recover? You can't. And so in that model, that's one of the reasons why I believe physicians believe, I don't think they're bad people, I think they just believe that there's nothing that can be done. And they never really see thyroid physiology recover because they're always suppressing thyroid physiology with thoughts of T4, suppressing TSH, so there's no drive for the thyroid gland to ever recover. In integrative and functional medicine, there's a lot of people that believe similar things, but there's a lot of people that believe that stress on our physiology is driving it. So they're aware that cell stress is the driver of the upregulated immune system. They believe that cell stress is driving the immune system to create problems. Many of them just believe that the immune system is out of control because of this cell stress, but they're fully aware that these stressors can be what's driving it, and they do put effort into trying to reduce the cell stress, address the infection, the mold, the emotional stress, whatever is your stress load, they're working with you to address it. The problem is, even though they're aware that cell stress is the issue, they look at what a medical physician's doing and says, hey, they're only looking at TSH and T4. We need to look at T3 and free T3 and maybe reverse T3 and thyroid antibodies because that gives us a clearer picture. And the thyroid antibodies can give us a clearer picture if there's autoimmunity. But to be honest, a lot of people have thyroiditis, Hashimoto's, and don't have thyroid antibodies. And so we can't just look at antibodies and say, well, if you don't have antibodies, you don't have thyroiditis. And if you do, you have Hashimoto's. That's not really the way the physiology works. But what happens, and I think it's a challenge for us in the integrative and functional medicine space, while they're fully aware that cell stress is causing the immune system to be upregulated and potentially that cell stress is driving the thyroiditis and the hypothyroid condition, they look at the reduced conversion of T4 to T3 and the rise in reverse T3 as the actual problem. They say, hey, your body's not converting T4 to T3, like it can't do it anymore at a high enough level, and your body's over converting T4 to reverse T3. And so they look at that as broken physiology. And I want you to change that idea, change that thought concept, and realize that T3 is the active hormone. And the literature is pretty clear on this. When cells perceive danger, they slow down. Many of the systems in the body, their metabolism is slowed down under this cell stress or cell danger response. There's reduced conversion of T4 to T3. There's an increased deactivation of T4 to reverse T3 and an increased deactivation of T3 to T2. That's not broken physiology. That's the adaptive response. And so what many integrative and functional practitioners are doing is they're loading T3 into the system to try and optimize T3 as if the conversion is broken physiology. And it oftentimes isn't. Yes, it can make you feel some temporary improvement of symptoms. But what I see is that a lot of people get the initial hit of thyroid hormone and they feel a bit better, but then it doesn't last. Why doesn't it last? Because they still have this immune inflammatory cell danger response going on. So they start ratcheting up the level of T3, and they get to a point where now they're feeling hyperthyroid and hypo at the same time. So the paradigm shift I want you to consider, especially if you're one of those people who's struggling with chronic hypothyroid symptoms despite T4, despite NP thyroid, despite armor, despite additional T3 or T3 only. If you're feeling really well, feeling great on T4 only, that's perfect. Maybe you don't have a cell danger response going on anymore. If you feel fantastic and restored on armor, NP thyroid, that's great. Maybe that's the right treatment for you and you don't have a cell danger response going on anymore. If you feel awesome on really high dose T3 and you think that's the best option for you, that's fantastic. I'm not talking to those people. I'm talking to those of you who still have chronic hypothyroid symptoms despite whatever type of thyroid medication and dose you take, and you're spending so much time, and maybe your clinician's spending so much time figuring out what's the right dose to optimize the lab value instead of actually addressing what's creating the cell stress and danger response on your physiology. So when you experience a cell danger response, there's lots of things that happen at the cells and tissues. The cells stiffen their cell membrane. They reduce transport of glucose and other nutrients into the cell. They increase inflammatory chemicals. And their goal is to slow down the metabolism and ramp up defensive mechanisms. And inflammation is one of those. If you got a splinter in your finger, that splinter is signaling a danger response. And what happens? There's lots of inflammation. There's lots of swelling. You wouldn't necessarily treat the inflammation and try and knock out the inflammation. You wouldn't cut the finger off. You would just pull the splinter out. Many times the things that don't make us feel good, like the pain from having a splinter in our finger or the inflammation from the splinter, is the sign of the problem and not the actual problem. And I think we do this too often in traditional and to some degree in functional medicine as well. So why this matters, when you realize and start to look through this paradigm that thyroid physiology isn't broken, your immune system's not out of control, now you have the ability to heal, repair. You don't believe your body's attacking you. That's a terrible place to be. You believe you can get well, and it changes from how do I optimize my labs or manipulate them into range with medication, and instead say, what's creating my cell stress? What's creating my cells to perceive danger? Is it physical stress? Is it my diet? Is it the bacteria out of balance in my gut? Is it a chronic infection somewhere in the body? Maybe an infected root canal? And you start to address the root causes. Maybe it's the relationship with your spouse, or the stress from work, or the stress from finances, or maybe it's a combination of all of those things. But once you realize it's the external things and not just a thyroid physiology and immune system that's totally out of control, now you have control and you can start making changes, reducing those stressors, improving habits, improving behaviors, improving diet, and you can actually recover. How do I know? Because I've been doing this 30 years and I see people recover their thyroid physiology all the time, need to take less and less medication. Many of them don't even need thyroid medication anymore. And we don't have to manipulate T3 into a range with medication, but we see it return to normal levels because the cell stress physiology is gone. So the other reason it matters is so that you stop focusing so much, you and potentially your clinician, on how do I optimize T4 or T3 or TSH or reverse T3, and by manipulating those lab values with hormones and get busy with the real issue, which is what's creating the cell stress and cell danger response, and understanding that the reduced conversion of T4, T3 isn't the problem. That's a sign that there's still a cell stress or danger response going on. You can't manipulate it into an optimal range and assume that you're going to optimize health if there's still cell stress going on. 3, it changes the focus of the lab, the focus from lab value to cause. So you could say, yeah, my lab values are abnormal. You don't need to panic about the abnormal value. You just need to look at it and say, okay, I still have more work to do if I'm not converting T4 to T3. So it changes the thought process and it changes the strategy. And lastly, and probably most importantly, it prevents thyroid medication from actually contributing to the stress. So many people are so busy trying to optimize their T4 or the TSH or T3 or reverse T3 with medication that they don't realize that their excessive use of thyroid medication, so many patients who come to see me are taking way more medication, T4, T3, than their body would ever make if it was healthy. So they're over medicating, and that over medication with T4 and T3, NP thyroid, whatever you're getting prescribed, many times is actually one of the biggest factors creating more signs and symptoms and making their immune system more dysregulated. I hope this helps. If you have any questions, put them below wherever you watch this video. And if you need help and you want a different look at your thyroid physiology and maybe need a new course, then DM me Discovery, and my team will send you a link to a complimentary discovery call, and we can talk about what's going on in you and maybe what a new strategy might look like for you.